Okay, I'm Dr. Betita, and I've been tasked to discuss health and wellness, models of disease causation, and natural history of disease. So here are my objectives. Okay, before anything, we need to discuss what is health and disease. So first, this is the definition of disease. A disease is a particular abnormal condition that negatively affects the structure or function of all or part of an organism and that is not due to any immediate external injury. If the abnormal condition that negatively affects the structure or function of all or part of an organism is due to an immediate external injury, this is trauma. Okay, that's going to be a different discussion. So, for purposes of our discussion, disease is as written in this slide. Okay, health. According to the WHO, and this is found in the preamble of the Constitution of the World Health Organization, health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. Like anything in this world, there are those who will criticize this definition, and it has been criticized as being overly idealistic in its expectation of complete well being. And this view of health is static rather than a dynamic process that requires constant effort to maintain. Kasi kagaya ng sinabi sa definition, it is a state. So if it's a state, your state of health will be different today, it will be different tomorrow, it will be different a week from now, a month from now, etc., etc. Goes so on and so forth. Furthermore, your health is constantly changing. It's a dynamic process, and it requires effort on our part in order to maintain a state of good health. So those are the criticisms of this WHO definition of health. So how do we answer this definition? So Dubas posited that health is successful adaptation. So the state of health or disease are the expression of the success or failure experienced by the organism in its efforts to respond adaptively to environmental challenges. So this means that a person is considered healthy when he is able to successfully adapt to the various challenges that he or she faces from the environment. Okay. Now, these environmental challenges are referred to as stress. Stress denotes any response of an organism to demands, whether they are biological, physical, psychological, or social. So when we talk about demands, these are things like hunger. When you're hungry, you have to eat. When you are stressed, you need to relax. When you are tired, you need to rest. So those are stresses. And when we are stressed by things that are going on around us, the body needs to adapt. And the adaptations are those things that I mentioned. When you're tired, you need to rest. When you are hungry, you need to eat. Eating is an adaptation, resting is an adaptation to those stresses. Okay? Use stress or stressors that are helpful. For example, exercising is helpful. Okay? Um, Distress naman are stressors that are harmful. Okay? Examples of distress would be pathological forms of stress, insomnia, yung mga vices natin. Okay? Allostatic load is the ongoing level of demand for adaptation to stressors on an individual. So allostatic load is simply the sum of all of the stressors that you are going through, whether these are eustress or distress. Allostatic load is just the sum total of all of the stresses that the body is going through. Okay. Another answer actually to the criticism is health as satisfactory functioning. So Breslow stated that both the current state of a human organism's equilibrium with the environment, often called health status, and the potential to maintain that balance. And Dubos said that clearly health and disease cannot be defined merely in terms of anatomical, physiological, or mental attributes. The real measure is the ability of the individual to function in a manner that is acceptable to himself and to the group of which he is a part. Okay, so this statement is very powerful because not all illnesses or not all, hindi lahat ng pathological processes that the body goes through requires treatment. Okay? Just because you have a headache doesn't mean that you need to take a pain reliever or an NSAID. Okay? Just because you are having insomnia doesn't mean that you need to take a tranquilizer to help you sleep. It's simply whether or not you are healthy or not depends on whether or not your body is able to function in a manner that's acceptable to yourself. So if you're able to tolerate the pain, if you're able to tolerate the insomnia, if you're able to tolerate the loss of function, then that is still healthy. Do you follow? Okay. So models of disease causation. There are different models of disease causation. The simplest model is the web of causation. So the web of causation is simply just a web or an algorithm or a brainstorm which shows the various processes or pathways that lead to disease. In this example, this is an example for cardiovascular disease. So diet, cholesterol, physical activity, genetic factors, they all lead to obesity, leading to hardening of the arteries, and this leads to hypertension, hypertensive disease, stroke, heart disease. Okay. So this illustrates the various pathways by which these pathological factors, when added together, result in illness or disease. So it's simply a chart showing the relationships between the various factors, and the arrows indicate the direction of that relationship. Okay. The epidemiological triad lever is another model of disease causation, wherein an external agent, a susceptible host, and the environment that brings them together. Okay. So you have your agent, your host, and the environment that brings them together. Agent-related factors are as follows. Environment-related factors are as follows. And host-related factors are as follows. Okay. The principle behind the epidemiological triad is that if you're able to break the interface between agent and host, the interface between host and environment, and the interface between agent and environment, you are able to prevent the onset of disease. For example, if you want to prevent the agent from entering the host, and you know that the agent lives in, say yung nangyari recently with all of the flooding, okay? Leptospirosis lives in floodwaters, okay? And it enters the body through open wounds. So the best way to prevent it is to find a way to block the entry of the leptospires who are residing in the floodwaters from entering the open wound. So how do you go about doing that? You can do that simply by wearing boots. Okay. So in this example, you are preventing the interface between the host and the environment, which is the floodwaters where the leptospirosis lives. And the mode of transmission is yung open wound ng pasyente. Okay. So epidemiological lever, this is basically just a fulcrum, where the environment is the fulcrum, the agent is on one side of the seesaw, and the host is on the other side of the seesaw. When, in the first example on the upper left corner, the agent, there was a change in the system such that the agent-related factors became heavier, which resulted in there was a change in the environment which increased the infectivity or some agent-related factor. Okay. In this example naman, there was a change in the environment which increased the host-related factor, and therefore the host-related factor became heavier. Okay. In this example naman, there was a shift in the equilibrium towards the host, which resulted in an increase in the agent-related factor. In the last example, there was a shift in the system towards the agent, which resulted in an increase in the host-related factor. Okay. All right, so agent. So an agent is a factor such as a microorganism, chemical substance, or form of radiation whose presence, excessive presence, or relative absence is essential for the occurrence of the disease. So it's the causative organism. Okay. This was originally referred to as an infectious microorganism or pathogen, like a virus, bacterium, parasite, or other microbe. However, it has recently been posited that there are non-infectious agents like mechanical forces in carpal tunnel or fatty food in atherosclerosis. Okay, so agent is what's causing the disease. Okay, so examples are your bacteria, your protozoa, your viruses, and these are fungi. So this is your spaghetti and meatballs pattern. Okay. Reservoir. The reservoir of an infectious agent is the habitat in which the agent normally lives, grows, and multiplies. It may or may not be the source from which the agent is transferred to the host, so examples would include humans, animals, and the environment. An example of a reservoir would be the soil for Clostridium botulinum. So Clostridium botulinum normally lives in the soil, and this is where it normally grows, lives, and multiplies. Okay. So this is the reservoir where the agent normally lives, grows, and multiplies. These are the different modes of transmission. So you have direct contact, vector, vehicle, airborne droplet, and these enter a susceptible host in order to cause your infection. So this is your chain of infection model. Okay. So vehicle, this is the mode of transmission of an infectious agent from its reservoir to a susceptible host. This can be person to person, foodborne, vector-borne, waterborne. Basically, a vehicle is anything borne. Okay? All right. So vector is any living carrier that transports an infectious agent from an infected individual or its waste to a susceptible individual or its food or immediate surroundings. So vector is a living carrier that transports an infectious agent from an infected individual to a susceptible individual. So from an infected individual or an infected animal to a susceptible individual. So the agent may or may not pass through a developmental cycle within the vector. For example, mosquitoes for malaria or fleas for plague. So, okay. So mosquitoes in malaria, ticks, snails, and your flies. They can all be vectors. So host refers to the human who can get the disease. Risk factors are factors that are intrinsic to the host which influence an individual's exposure, response, or susceptibility to an agent. And these host-related factors can include genetics, hygiene, sexual practices, or nutrition. Environmental factors are extrinsic factors that affect the agent and the opportunity for exposure. And examples of environmental factors include air quality, weather, sanitation, health services, running water, and sewage. Okay. So this is the epidemiological triad for TB. The agent is your Mycobacterium tuberculosis. Your environment is related factors include crowding, poor ventilation, bad sanitation. These all lead to increased susceptibility to TB. And for the host, related factors, these include poor nutrition, concurrent disease, and low immunity. Again, all of these things can lead to increased transmissibility of your TB. Okay. So chain of infection, you have a susceptible host, you have a pathogen, which lives in its reservoir. It leaves its host organism through the portal of exit, transits to a susceptible host via a mode of transmission, enters the susceptible host through a portal of entry, and causes disease in that susceptible host. Okay. So another model of disease causation is your Rothman's causal pies. So each pathway each pathway of causality is represented by a circle or a pie. Okay. This is useful when causation is multifactorial and you have multiple pathways of disease causation. So you have a circle or a pie which represents a particular pathway of causality, and you cut up that pie, and each slice of that pie represents a step in causality. Okay, so a sufficient cause is when the pie is completed. A component cause is each individual factor or each piece of the pie, and a necessary cause is a component cause that appears in every pie. So if it appears in every single pie, that means it's necessary for disease causation, and therefore it's a step that must be looked into. Okay. So if you look at this example, death from a head-on car collision, there are three distinct pathways. Okay. Three distinct pathways. You have step A, B, C, D, E, and a different set of steps for pathway 1 and a different set of steps for pathway 2. Okay. Take note that what's common for pathways 1, 2, and 3 is letter A. So that means that letter A is a necessary cause because it's common to all three pathways. Okay. Letter C is common to pathway 2 and 3. You have three sufficient causes because you have three complete pies. Your necessary cause is factor A, like I just said. Okay. And the way you interpret this is that each step in the process is represented by a pie. The relative size of the pie indicates its relative contribution to causality. So a larger piece of the pie will represent a larger contribution to causality. And each particular pie represents a pathway of disease causation. So looking at pathway number one, this is car hits another vehicle, poor road design, low visibility, poor light, and faulty brakes. And all of these things lead to death from a head-on car collision. Okay. All right. So natural history of disease. So natural history of disease is progression of a disease process in an individual over time in the absence of treatment. So there are four stages here: the stage of susceptibility, stage of subclinical disease, stage of clinical disease, and stage of recovery disability or death. Stage of susceptibility, you have a healthy patient. He doesn't have the disease yet. At this point, this patient is not ill. He has not yet been exposed. The patient is exposed to the causative agent, and the period of exposure until the onset of symptoms is your stage of subclinical disease. During the stage of subclinical disease, pathological changes occur in the body, and these pathological changes accumulate over time. Eventually, they will reach a tipping point wherein they will start to cause symptoms. Once they cause symptoms, this becomes your stage of clinical disease, and oftentimes this is also corresponds with the time when a particular illness is diagnosed. Eventually, the pathological changes will continue to accumulate, or with treatment, the pathological changes are arrested or reversed, and this will lead us to the outcome stage. And there are three possible outcomes: either the patient will recover, the patient will become disabled, or your patient will die. Take note that all diseases follow the same pattern this same natural history. This occurs in all diseases, okay, regardless of whatever it is, whether it's TB, HIV, asthma, COPD, hypertension. Every illness in any textbook will follow the same pattern. Okay, the difference between the illnesses, however, will be the relative duration of each stage. Okay. Okay. Susceptibility, the disease has not yet begun. This is the accumulation of risk factors that facilitate entry of the agent into the host in a favorable environment. Examples: previous illness, lifestyle, hygiene, precautions, safety measures. These risk factors will accumulate and they will facilitate entry of the agent into the host in a favorable environment. Again, your epidemiological triad. Exposure begins with exposure to a risk factor or causative agent. Example: cancer, you have the accumulation of a particular risk factor which leads to cancer, like smoking, which results in the accumulation of carcinogenic compounds in the lungs, which eventually leads to pathological changes that lead to cancer. Or COVID-19, exposure to the COVID virus. This leads to pathological changes in the body, not just in the lungs, but the circulatory system, the heart, throughout the body, the immune system, etc. The portal of entry is the site through which the agent enters a susceptible host and thus causes disease or infection. The portal of exit is the site where the microorganism leaves the host to enter another host and cause disease or infection. Okay. The stage of subclinical disease. This is from the time of exposure to onset of disease symptoms. This is when pathological changes begin to occur in the body. The stage of subclinical disease is asymptomatic. There are no symptoms at this point. This is sometimes referred to as the incubation period for infectious diseases. This can also be referred to as the latency stage for chronic illnesses. Patients can also become carriers. These are patients who have subclinical disease but are infectious. They are asymptomatic, but they can spread the disease. Okay. Clinical disease is characterized by the onset of symptoms. This is the time when most illnesses are diagnosed, and this has a highly variable spectrum of disease. So the disease process at this stage may be mild to severe, and it may also result in fatal outcomes. And lastly, your outcome stage. And as I said earlier, there are three possible outcomes. Either your patient may recover, your patient may become disabled, or your patient may die. Okay. Infectivity is the proportion of exposed persons who become infected. Pathogenicity is the proportion of infected persons who develop clinically apparent disease. And virulence is the proportion of clinically apparent cases that are severe or fatal. Okay. So let's take a look at the natural history of TB infection. So your patient is exposed to Mycobacterium tuberculosum. This results in infection. Usually the incubation period is somewhere between 4 to 6 weeks. Your T cells start to respond to the to the Mycobacterium infection. Eventually, the body will be unable to control the bacterium, which results in active TB. Um, or initially, there may be immune control of the bacteria, and you might have latent TB. Okay. Um, After a while, your patient's the TB may reactivate, and you may either have active TB again, your TB might be contained, or you might have elimination of the bacteria. Okay. And again, as in the case of all other illnesses, your tuberculosis may result in either recovery, disability, or death, depending upon whether or not we were able to intervene in time. Okay. So levels of prevention. There are 5 levels of prevention: primordial, primary, secondary, tertiary, and quaternary. So primordial level of prevention, this is risk factor reduction targeted towards entire population through a focus on social and environmental conditions. So examples of primordial prevention would be laws and national policy. These are often aimed at children to decrease as much as possible the exposure to the risk factors. Examples would include improving access to an urban neighborhood, to save sidewalks to promote physical activity. This, in turn, decreases the risk factors for obesity, cardiovascular disease, and type 2 diabetes. Okay. Examples of primordial prevention: increasing taxes on cigarettes, decreasing advertisement of tobacco, limiting access to alcohol to persons aged 21 and over, and your built environment or access to safe walking paths, yung mga bike lanes natin, sidewalks, access to stores with healthy food options. Okay. So these are all examples of primordial prevention. Sidewalks, bike lanes, yung cigarette warning law natin, yung smoke-free environments in public places, kahit yung sin tax law, which prohibited the sale of, which heavily taxed sugary food and drinks. Okay, primary preventions are measures that are aimed at a susceptible population or individuals. This targets healthy individuals. And the purpose of primary prevention is to prevent the disease from ever occurring. These are activities that limit risk exposure or increase the immunity of individuals at risk to prevent the disease from progressing in a susceptible individual to subclinical diseases. So an example would be vaccination. So remember, in primary prevention, the target is healthy individuals. In primordial prevention, the target is entire populations. Okay? And mostly you're targeting young people in order to eliminate as much as possible the risk. So that's primordial. In primary naman, you're targeting healthy individuals. Okay? Examples of primary prevention: immunization, tobacco cessation program, pero this presumes that your patient still hasn't developed lung cancer or any of the other health sequelae of tobacco smoking. Needle exchange programs and micronutrient supplementation programs. Okay. So this picture is vitamin A supplementation. This is your typical vaccination. Your needle exchange programs and condoms for the prevention of HIV/AIDS. Okay, bucket condom use is considered primary. It's because you're giving these to healthy individuals to prevent infection. Okay. Okay, secondary, this is early disease detection or screening. So the target here is healthy appearing individuals with subclinical disease, asymptomatic. So this targets the stage of subclinical disease. Okay, so primordial, this targets entire populations at who uh, who are at risk. Primary prevention, this targets healthy individuals to prevent them from getting sick. Secondary, these are for people with subclinical disease who may be sick but don't know about it yet, or who do not have the symptoms yet. Okay, so that's why we do screening tests. So examples of secondary prevention are all of your screening tests, like your pap smear for cervical cancer, your BP monitoring for hypertension, your fasting blood sugar, and HbA1c for the detection of diabetes. Okay, examples of secondary prevention, again, your pap smear, mammography for early detection of breast cancer, colonoscopy for early detection of colon cancer. Another example for colon cancer would be your FOBT, and your blood pressure screening using BP monitoring. Okay, so this is your cervical screening. This is the vinegar test. So if you see this after you apply your acetic acid, then this patient may have cervical cancer. Colonoscopy to screen um, for colon cancer, and the various blood tests that we do to screen for various diseases. Okay. Tertiary naman targets both the clinical and outcome stages of a disease. So your patient is already sick, your patient is already symptomatic, and it also targets the outcome stage of disease. So examples would include rehabilitation. Examples would include lahat ng treatment natin, rehab. So this is implemented in symptomatic patients and aims to reduce the severity of the disease as well as any associated sequelae. This aims to reduce the effects of the disease once established in an individual. An example would include your rehabilitation. So any treatment, any rehabilitation that falls under tertiary prevention. So examples of tertiary prevention: occupational and physical therapy, cardiac rehab, diabetic foot care, medications, diabetic medications, hypertensive medications, lahat ng uri ng treatment, surgeries, those are all tertiary prevention. Okay? Okay, so this is Dakin solution. So Clorox, clean water, baking soda, that's your Dakin solution. That's for wound care. This is diabetic foot, lahat ng uri ng rehabilitation. And don't forget treatment, kasama yan sa tertiary prevention. So quaternary naman, this is an action taken to identify patients at risk of over-medicalization and to protect them from new medical invasion and to suggest interventions which are ethically acceptable. So ang keyword dito is over-medicalization. So this is an action taken to protect individuals from medical interventions that are more likely to cause more harm than good. So an example, radiological incidentalomas, hindi lahat ng nakitang bukol on radiology ay nangangailangan ng treatment. The use of antiarrhythmic drugs after MI, these can reduce arrhythmia but they can increase mortality. Okay. It used to be a common practice to give HRT, hormone replacement therapy, to women postmenopausally, like estrogen. This was done actually to decrease the cardiovascular risk, but it has been shown, aside from cardiovascular risk, also to decrease the symptoms of menopause. Unfortunately, hormone replacement therapy in menopausal women has been shown to increase the number of cases of breast cancers, stroke, and thromboembolic events. So it was also a failure in reducing cardiovascular mortality, which was precisely the point of giving this treatment. Okay, medically unexplained symptoms. You'll see a lot of that in the States. Functional disorders, bodily distress syndromes, yung mga somatic disorders, yung mga physical complaints that are actually due to psychiatric illness. Okay, and so how do we do that? Follow the guidelines, litigation, HMO guidelines, and being judicious in the use of diagnostics. Okay, so these are my references, and thank you for listening. We'll have the questions during your Q&A. So thank you for your time.